All right. Now, if you live in Israel and get your healthcare through the country's public healthcare system, then you've probably found yourself struggling to get an appointment with a doctor at some point. Why? Well, Israel's been facing a shortage of doctors for years now, especially in the periphery, the countryside. There are lots of reasons for this. There's a shortage of places in Israeli medical schools, which prompts many Israelis to study abroad and then work abroad. There's been a wave of doctors from Israel's baby boom who are retiring. And then when you mix all of that with Israel's growing population, especially its elderly population, it makes for a very serious shortage of physicians. Well, now an organization called the Israeli Experience has dedicated itself to bringing a record number of doctors from Russia and Ukraine to Israel this year as part of a program to prepare them for the Ministry of Health's licensing exams and to address this very problem. And joining us now is Dr. Andrey Esav Apostolov. He's a 27-year-old oncologist from Russia who is also the 7th generation in his family to be a doctor. And he's also a graduate of MASA Doctors by Israel Experience. And we have Maria Leichik, the coordinator of the Russian-speaking program in Israel Experience. All right, so Maria, I'd like to begin with you. Tell us how this program came about. You know, I really kind of want to know why you're focusing on bringing doctors specifically from Russia and Ukraine to Israel.
Well, first of all, the Israel Experience itself is one of the biggest organizers among the MASA project, the big project in Israel. And we're not just bringing doctors, we're bringing young Jews from all over the world. Our department specifically brings young doctors from the whole Eastern Europe, not only Russia and Ukraine, helping to preparing them for the licensing exam in Israel for being a doctor.
And specifically, there's been more of a focus on doctors from Russia and Ukraine. Is that because of the war?
We've been doing this program for 15 years now, so it's this year program was our anniversary program. So all these 15 years, it's been participants not only from Russia, Ukraine, also from Belarus and Kazakhstan and Georgia. This year we brought 100 people, and it's from 7 countries from the Eastern Europe.
Interesting. So I'd like to turn to you, doctor. I mean, what has your experience been like working as a doctor here in Israel compared to working as a doctor in Russia?
So it's really hard to compare because I haven't not work as a doctor in Israel yet. I have only experience in Russia, but I already can say that to be a doctor is tough and it is hard way that spent many years. But in Israel there is a huge help from Israel government and from MASA project, for example, and it's a really brilliant opinion because we didn't know what we met in this country, but MASA program helped us to get a home, to get a good education, to get a great knowledge about medicine, and I think that's opinion. That's example. It's really makes sense to think about how much Israel gave to me, but I'm not only one.
Well, I'm interested to understand, why you were interested in coming here. Obviously, you've been experiencing a lot in your country over the course of the last year, but what is kind of the perception of working in your field in this country?
I really wanted to I really wanted to move here from my childhood, and I think the main idea that make me move it and make me try it, it's because I'm a Jewish and I want to live in Israel and work for Israel medicine, for Israel health, and it's very important to me, but I think Israel and Israel medicine gets really big opportunities to make a good professional, and I think it's a good option for me and for my future.
I'd like to ask you now, Maria, you brought, like you said, hundreds of doctors from abroad to kind of get their medical licensing and stay here. What has kind of been the long-term impact of doing this? And do you think that this is really enough in kind of addressing the issues that the health industry faces here?
As you said, Israel is experiencing a shortage of doctors, and if you can just imagine 100 every year, well, it's the first year that we brought 100, but we've been bringing a lot. It's like an additional faculty for all the doctors, from Israeli doctors that study here, or Israeli doctors that study abroad and come here, which means that we are adding a huge number of future professionals, not only in the center of the country, but also in periphery. And also, if we're talking about the level of the students, not only are they experienced doctors there, they also have a wonderful result in average exam, how they pass the exam.
Results, yeah.
If we even compare them with all the guys that pass the exam, the average percentage of our passing is higher.